Hello there. Welcome to my show, COVID-19 update by Heerak for August 6th, 2020. Yeah, it's almost TGIF. Yeah, it's Thursday. Tomorrow is Friday. TGIF. So yeah, it's as you know, it's beach time. You only have about a month left in the summer, so obviously you don't want to throw away your beach season. Um, yeah, we don't know what's going to happen in the winter, but one thing you can be sure of is everything is going to be closed. you know, because everything is closed now. Movie theaters are closed, restaurants are closed, bars are closed, cafes are closed, bowling alleys are closed, gyms are closed. In many places. Um, Everything is closed now and it's summer. Can you imagine how it's going to be like in the winter? So if you don't have fun now, you're going to regret it. I mean, literally, you're going to die regretting it because you may die during the flu season. If you're overweight, it doesn't matter how old you are. If you're overweight, if you get COVID, you have a high chance of dying. Yeah, I mean, it's incentive to lose weight. I mean, go jogging, man. Get that weight, down. Before flu season. It's one way to live, one way to survive. But yeah, I mean, this summer, you have, like what, 4 weeks of summer left. You better use it the best way you can. Go to the beach every day if you can. I mean, geez, you gotta like stock up on fun because winter is gonna be horrible. It'll be boring. If you go to the beach during weekdays, probably there's like less people. But obviously on Saturday, you should definitely go to the beach, because it's like, geez, it's like winter is coming and it's going to be horrific. And you could wiggle your toes on the sand. It's a National Wiggle Your Toes Day. And I don't know if you had a chance to see the movie Boomerang. Boomerang is a movie with Eddie Murphy. It's a classic. Eddie Murphy is a comedian who's created a lot of good movies. And you can watch Boomerang, and he is this guy who has like he wants perfect feet. A lot of guys are like, they like feet. I don't know why that is. Um, like pretty hands, pretty feet. I mean, I guess most guys want everything about the woman to be pretty, but there's a reason why pedicures and manicures are done. I mean, women say they find it therapeutic, but obviously they want to show off their beautiful feet and their beautiful hands. Like if you wear high heels, a lot of the feet are exposed, right? Um, and the first thing that the man looks at could be your eyes, but it could also be your feet, right? Because he may be shy and looks down and then sees your feet. you know, um, that may be reason why. But that right next to the boomerang, you see the feet. That's from the movie Boomerang. And if you see the movie, you'll see that scene. Yeah, Eddie Murphy's kind of funny. And obviously, when a woman wants to be enticing, and she raises up her leg like that, you see her feet, right? If she has ugly feet, it's not so enticing. And you see the beautiful woman there, she's pretty, and her feet are kind of pretty too, right? Um, you figure, the symmetry and everything. If a woman has beautiful face, she'll probably have beautiful feet. I mean, it's not always the case, but people see feet. Like that woman was kind of, you know, you know, on all fours. You notice her feet, right? Her feet is right there. I mean, it may not be the first thing you notice, but you certainly notice it. Um, and there are women lying down on the sand, and they're pretty, even from behind. But obviously, you look at their feet too. I mean, so people look at women's feet from front and back. So I mean, there's a point to what Eddie Murphy in Boomerang said about feet. I could see why some guys are really into feet, or they're really, they want women to have pretty feet. And obviously women want to have pretty feet too, so they go for pedicure. I remember Megan Savage, she was the president of a Graduate Nursing Students Association for 2019 cohort of clinical nurse leaders. As you know, I'm in the cohort of 2020, the year after that. And our president is Meredith Goodrich. Hi, Meredith. She's great. I love Meredith. She's Meredith Goodrich. She's from Ohio, and she's been our president for like a year. And she's really pretty and she's really smart. And yeah, I'm sure she's going to make a great nurse. And yeah, she's an amazing woman. So we have a lot of amazing people in our program. We had 34, and then 9 kind of dropped out of our cohort, 2020. So we now have 25. And every single one of them are amazing, so amazing. So I look forward to like lifetime of working together with them, in the field of nursing. As you know, we were trained to be clinical nurse leaders. So many of us will be working as clinical nurse leaders, or nurse managers, chief nursing officers. I could see like every one of my fellow corps members becoming like a chief nurse officer somewhere. They're all amazing. And obviously, Meredith Goodrich from Ohio, she's became president because she's amazing. People voted for her. Um, she's really nice. I really like her. Um, Everybody likes her. Obviously, that's what they voted for her to be president. I was vice president of a graduate student nursing association, graduate student government, graduate student government. Yeah, Georgetown University Graduate Student Government. Yeah, GradGov. So obviously I became vice president because I'm very popular, Yeah, so I was vice president from 2019 May to 2020 May. And we have a new term that started in May. And I got an email today from Elizabeth Linsky. She was, I guess she sent it out to all the graduate students, but she's now the new director of groups. So, so she's being very active as the new director of groups. And yeah, so EJ held that post last year with me when I was president from 2019 to 2020 May. EJ, he got his bachelor's degree from USC. He was director of groups, but now Elizabeth Linsky is, and she's really active. And we didn't even send anything out really until like, because I guess mid August is when things start for Georgetown graduate students, because they come and then we have our orientation in like mid-August, to late August. But yeah, Elizabeth is like sending stuff out. Linsky, she was the senator. I welcomed her into the graduate government Senate, GradGov Senate, because obviously I'm the vice president from 2019 May to 2020 May, and I organized the GradGov Senate. So I contacted GradGov senators, and I contacted director of studies to encourage them to hold an election or appoint a GradGov senator. So, each department could use one of several ways to send us a Senate. They could use the election, so all the members of the department vote for a senator, or the director of program can appoint a senator. Because just because, different programs are kind of, differently structured. And sometimes some programs are too big to hold like an election for GradGov Senate in the beginning of the year when they start out. So sometimes, the director program appoints a senator. For example, we have security studies master's program. It's a 2-year master's program. A lot of FBI, CIA, Homeland Security people are in that program, and some are working full time in the FBI, CIA, Homeland Security or NSA, and they're getting this degree part-time, they're getting that paid for by the federal government. But, in that program, there's like 500 students. So, it's not always easy to have an election, So sometimes departments that have like 500 graduate students in the program They like director just appoints a person. And I go to their events, security studies masters events, and I meet like all these FBI, CIA, Homeland Security agents. It's funny. Yeah, we have a lot of them around at Georgetown, because this is Washington, D.C., and you could do full-time masters, but a lot of people do part-time masters. So like I know a lot of guys who are like or women who are in FBI, CIA, who do like part-time masters. So they work full-time in FBI, but they take a class every semester. They 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 get the degree and over a longer period, and then the FBI pays for it or whatever. There are a lot of people in the military intelligence, Pentagon, people who are currently working in the Pentagon or taking masters. And I'm sure that's like that with like American University and George Washington University as well. Like and Howard University. These area universities. Maybe even George Mason University, which is a little bit out of the way, but Quantico is probably closer to George Mason. So, I wouldn't be surprised if that's that's happening there too. But right now Georgetown University is 100% online classes. George Washington University is 100% online classes. American University is 100% online classes, which I think is smart because we don't need FBI agents to drop dead. We need people to live. I'm trying to get Howard University and Catholic University America to go 100% online because obviously there are three reasons for that. I don't want students, faculty, and staff at Howard University to die. Because Howard University, I like Howard University. I like the students at Howard University. Um, so, and they're great professors at Howard University. I work mostly with the education department there. But maybe now that, I'll be working as a nurse at Virginia Hospital Center, maybe I'll get involved with the, nursing department at Howard as well. So, I'm from Georgetown, but I have a soft spot for HBCUs, historically black colleges and universities. I did my teacher education at Virginia Union University, which is an northern university than Howard. And Virginia Union University is in Richmond, Virginia. And they have a divinity school that produces Christian pastors. Howard does too. It has a divinity school that produces pastors. A lot of African American universities are very Christian oriented, which I like, yeah. So, so I have a soft spot for, Howard University. And when I was at Savoy Elementary School as a fifth grade teacher before starting out full-time at Georgetown University in a 3-year master's program in clinical nurse leader program. I'm in cohort 2020, clinical nurse leader. I work actively with the Department of Education at Howard University, so I know the professors very well. They're all really amazing. So, and I'm currently working on a doctorate of education thesis on improving inner city public schools. I'm kind of targeting all Black public schools, but also Hispanic. Those are the majority in like inner city areas that I'm focusing on because I'm interested in educational equity. So I focus on the most struggling schools in the urban areas. So I'm writing my dissertation and I'm creating a tool, what we call in research instrument, so qualitative tool, research instrument to use in our research. So I'm focusing on how to be a good principal of a urban public school or urban school, inner city urban school in poverty areas. So, I sent out a bunch of emails to the Principal Institute at Harvard. My focus is principal clinical supervision. It's basically focusing on how principals can act as an educational leader by guiding clinical supervision of classroom teachers. And that was actually started, the concept of clinical supervision was started at Harvard University in the Principal Institute, which was founded by Professor Kogan, who actually started the whole concept of clinical supervision. So Harvard University developed this concept and started running with it when Professor Kogan was a director of the Principal Institute. That was a long time ago, decades ago. And so it's kind of developed, but I feel I need to bring it into the inner city classrooms, apply it, and also, kind of consider the context, socioeconomic factors, socio-emotional learning factors. There are a lot of factors that I feel like we need to contextualize into the inner city classroom setting. So that's what I'm doing. So I'm basically, becoming one of the leading experts in America in urban education, especially Black urban education and Hispanic urban education. So sent out a bunch of emails today to Harvard Principal Institute, sent out a bunch of email today to Columbia University Teachers College. They have a pretty good education program there. The Principal Institute leaders, and sent out a bunch of emails to, you know, some leading schools in Georgia. As you know, I got my Master's of Education in Reading Instruction at University of West Georgia, which is in Carlton, Georgia. Got 4.0 straight A's. Um, and so, yeah, so I sent out some emails there because I'm trying to create this tool that everybody in the country can use to improve urban school education. So I'm creating this research tool. Uh, so yeah, and oh yeah, I also sent out a bunch of emails to Stanford University experts on principle. Uh, yes, I'm becoming one of the leading experts in America on principle, training principals to be good principals. As you know, I have my license um, in administration at DC Public, DC, city of DC. I can be principal anywhere. So I had that license. I applied it and got it. Um, I took the exam, obviously, the national certification exam, passed. That was a hard exam. It was, oh my gosh, we had to write so many essays for that exam. But I aced it, you know. So yeah. But anyway, yeah. So I'm becoming expert at training principals, and I know, Georgetown University actually trains principals. So when I'm done with my doctoral dissertation, I gotta give give the director of the person here at Georgetown a copy, because my plan is, obviously after years of teaching, and doing nursing, to go back to my alma mater, University of Pennsylvania, where I graduated with a bachelor's of arts in history with a minor in classical studies. To go back to my alma mater. As you know, I'm the vice president of a Penn Club of DC, where President Trump is a member, Ivanka Trump is a member, and Tiffany Trump is a member. Every alumni is a member, So yeah. So go back to University of Pennsylvania, my alma mater, become a professor of nursing in the School of Nursing. Penn Nursing, they say is number one. I don't know. I mean, Johns Hopkins say their nursing program is number one. I know our clinical nurse leader program at Georgetown is number one. So if you want the clinical nurse leader, just come to Georgetown. Yeah, but Penn says their nursing undergraduate nursing program is number one. I don't know. I can't really say. I haven't really studied it. I know it's really good. It's a 4-year Bachelor of Science and Nursing program. It's a very good program. Um, but I don't know if it's number one or not. But yeah, so I plan to go back to University of Pennsylvania, become professor of nursing in this nursing school, and then I will become professor of education at the graduate school of education that University of Pennsylvania has, which is considered one of the best in the East Coast, apparently. But and then I'll teach like trained principals. So I'll supervise research, doctoral research on principal leadership and stuff like that. And then I'll also become a professor in history and Jewish studies in the College of Arts and Sciences. And University of Pennsylvania has Center for Jewish Studies, where David Ruderman is the director. Penn stole him away from Yale. So, and it's the #1 Center for Jewish Studies in the country, in America. So, I'll be, probably a fellow there. Probably teach in the Department of Religious Studies as well. Yeah, I mean, and since I'm, an expert of diplomacy, I'm the president of Georgetown Collaborative Diplomacy Initiative at Georgetown in the School of Foreign Service. I'll probably get a joint appointment in the political science department. Penn has a Penn Biden Center for Diplomacy. I may come to Penn Biden Center of Diplomacy, teach some classes. It's not that far, DC and University of Pennsylvania, which is in Philadelphia. So yeah, there's a lot I can do, But yeah, so Penn is like dying for me to come there and be a professor. They've been wanting me to come there to be professor for like decades now, because I'm an expert in Jewish studies. I could have, been teaching Jewish studies for decades at Penn, but life is too short to just do one thing. That's my philosophy. Life is just too short just to do Jewish studies for rest of my life. You know what I'm saying? There's so many things you can do. And, University of Pennsylvania prides itself in being Benjamin Franklin's university. And Benjamin Franklin was a pretty versatile guy. Not as versatile as me, but, almost, comes close. Heerak Christian Kim is the Leonardo da Vinci of 21st century. As you know, I am running for U.S. Congress in Virginia's 8th District. Yeah, I intend to beat Don Beyer, who's the current congressman. And obviously, if you want to save America, you vote for me. Because I've been consistently right about COVID-19 from the very beginning when I started this show on April 2nd. And it's a daily show. And you can see all the reruns on the YouTube channel, Heerak Christian Kim for Congress, YouTube channel. Yeah, I've been consistent right. I'm consistent right this summer. I told you the death rate numbers will go up. Look at the death number. It's 2,060 in the last 24 hours. I told you death numbers are going to go up, didn't I? My predictions are coming true. So we went as low as like 300. But obviously, those numbers of 60,000 cases per day, I told you will catch up in about 3 to 4 weeks. And they're catching up. Yeah. And they're catching up in terms of deaths. So we saw numbers go from like 300 to 500, 500 to 700, 1,000, 1,200, And now it's at 2,060 Americans have died in the last 24 hours. This is summertime. There's no flu. A lot of the illnesses in winter does not exist right now. And we have 2,060 people dying. And death rate is going up. So, I told you like last week, we'll probably go to 2,000 this week. And so we went to 2,000, 2,060. Sometimes it's a curse being right all the time because, Heerak Christian Kim, independent candidate for U.S. Congress for Virginia District, that's who I am. I'm always right. It's a curse because I'm always right. But it's a blessing because I'm always right. Whatever I tell you in this show, there's a high chance that it will be right. Right? Because I'm the Leonardo da Vinci of 21st century. A person like me comes around every 500 years. Yeah. You will not, when I die, you will not see somebody like me for the next 500 years. So you're lucky because I live in your generation, right? During COVID-19, because I could give you guidance that you need. As long as you follow my guidance, you have high chance of surviving this, right? So you're lucky because if we did not have this show, you have close to zero chance of surviving COVID. But we have this show, so I give you guidance, all of my viewers and my fans out there in America and around the world. And I'm sure Dr. Fauci is watching the show every day religiously. Dr. Redfield, Dr. Hahn, I'm sure they're all watching this show. Admiral Gerard, of Homeland Security. I'm sure everybody's watching this show because there's only me, Heerak Christian Kim. There's one Heerak Christian Kim in the world. There's only one person like me in the world who is an expert in so many different fields. I'm licensed in, look at this, science, math, history, English, special education, reading specialty. Geez, I'm like, I go to a field, like field of education, and I dominate. Every field I go, I dominate. That's because I'm the Leonardo da Vinci of 21st century. Every field I enter, I dominate. because there isn't a field that I cannot learn. If I put my mind to it, I can learn any field. Oh, because I'm the Leonardo da Vinci of 21st century. Being Leonardo da Vinci, Renaissance man, means you can do everything. I just, I'm a human being like Leonardo da Vinci. So, yes, theoretically, we could do everything, but we're not God. We're humans. So we have limited time, and we apply that limited time to certain things. I believe that God sent me to nursing school to save your life from COVID-19. God may change his mind, but I was wondering why God is leading me in that direction, because I was having fun, teaching, um, because I love my students, at Savoy, 100% of my students are African American. I'm trying to make them into great leaders, great Christians, great leaders. I love Miss Johnson. She's a great Christian woman. So she's telling all my kids to go to church. Whenever she like comes for a special, she was our math leader. So so grade 3, grade 4, grade 5, there were 3 teachers. So Mr. Peck was the 4th grade teacher. I'm 5th grade math teacher. I taught everybody math in 5th grade, 100% of the students. Mr. Peck taught all the 4th graders students math. His wife got pregnant, had a cute little baby, so he took paternity leave for 2 months, and he was just playing around with his kid. He was so happy. Every guy loves to be a father, right? If you want your, if you want to be loved by your husband, just have a lot of kids. Men love kids. Um, yeah, yeah, and when you have babies, men love you more. That's how guys are. Guy may love you, but if you have kids, guys will love you more because you're the mother of his child. And just you gotta play that card. I'm the mother of your child. I'm the mother of your child. I was pregnant for 8 months. Do you remember? I'm the mother of your child. Play that card when your guy is like acting out, or spraying or whatever. But anyway, yeah, you gotta play some mind games with your husband because guys are like dogs. You gotta just put a leash on them, and pull them back. Yeah. Mr. Peck is, you know, uh, so he's the 4th grade teacher, and we had a 3rd grade teacher. Oh, she's really nice. She went to University of Mary Washington for her education training, um, and she has a really cool last name. Uh, she has one of those hyphenated last names, Sussman. But no, Sussman is one side of her family. I think it's like a Dutch side, Sussman. What's the other side? Uh, because in public school system we call each other Mister. you know, like so Sean is the 4th grade math teacher, but I don't call him Sean in the class. I call him Mr. Peck. And Sean calls me Mr. Kim. It's like, I don't know if you've ever been to a school system, but when you're teaching in a school, you don't call each other by first name because you're trying to model for the kids. You want kids to call you like Mr. Kim, Mr. Peck. So all the teachers call each other like Mr. Kim, Mr. Peck. So, it's funny, but because, even when you become friends, you call each other Mr. Peck, Mr. Kim, yeah, and yeah, so, what's her last name? One of her last name is Sussman. Um, Mary Louise Sussman something. It's like a famous name. I don't know if she's related, but I know they're like, I think there was somebody who ran for Democratic presidency office who has the same last name. It's not an uncommon last name. I wonder if she's related though, because she says she grew up in Princeton, New Jersey. Um, Let me see. Mary Louise, Mary Louise Sussman. Oh, there's another name after that. It sounds like a very British name. Mary Louise Sussman. Oh, I can't remember. So I mean, I mean, I bet she may be like a, she may actually have royalty or nobility roots, because she had that Dutch Sussman name. So she may have like noble or royal blood from the Dutch side. I think Sussman is the Dutch side. And then she has the other hyphenated, it's like a English name. She may come from like a noble blood or even royal blood. I don't know. We never talked about that. We're always talking about math, because we meet regularly and we're like a team. So Mary Louise and Sean and I, but we never call each other by first name. We always use like formal, Mr., Miss, you know. Um, and Jennifer Johnson, Mrs. Johnson, we always use the last name. She basically trained three of us. She was our supervisor. And whenever she comes to teach in my classroom, she's like telling all my kids to go to church. I'm like, is this like a revival or is this, a math class, But I love Mrs. Miss Johnson. She's wonderful. Yeah. But anyway, yeah. So yeah. So oh gosh, I love my kids. I want all of them to succeed. And but God leads you in a certain way, and over 300 million Americans are Christians, so I'm sure all of you can relate. Christians talk like this all the time, so 300 million Americans can relate to what I'm saying, but you feel like God's leading you, in a certain direction, right? So I'm, happy teaching these kids and everything, and then God, is like, um, kind of led me to Georgetown University for a master's degree in clinical nurse leader program. And I was kind of curious. Obviously one of the reasons why I want to become a nurse is I want to work on health equity because African American schools like Savoy Elementary School is mandatory, and the structure is there for a public school for the kids to go because it's a mandatory thing. But the healthcare system is not there. So if you go to Anacostia, um, not everybody has access to healthcare. Even if there is access, not everybody knows about it. So there are two problems to providing healthcare access in inner city: is we need to create structures that provide healthcare. Number two, we need to get a buy-in from African Americans in the neighborhood to utilize the healthcare system. There's a deep-seated mistrust of healthcare system among African Americans, and that's borne by evidence-based research. And we discussed it in vulnerable populations class with Professor Diane Davis um, last year. So yeah, so we spent like a whole 2 hours talking about that. How African Americans don't trust the healthcare system. So I mean, it's in evidence-based research, and I knew that since I'm a teacher in 100% African American school. So those are some challenges. So I know a lot of scholars in nursing talk about health equity, but they're only talking about like providing the services. But for me, Heerak Christian Kim, independent candidate for U.S. Congress, when I talk about health equity, I'm talking about getting the buy-in from the people there too. I consider everybody who lives in Anacostia as part of the healthcare team. They're stakeholders, so we have to consider their involvement, voluntary involvement, as an important issue in providing health equity. So I'm always patient-centered. I'm always like people-centered. I find like a lot of the research on health equity is more, down to bottom, kind of like hierarchical. So I find it slightly disturbing. But anyway, once I'm done with my Doctor of Education thesis, I'll probably work on a Doctor of Nursing, and I'll probably work on health equity, so, well, actually, Doctor of Education, I want to work on cardiac arrest patients, heart attack patients, reviving them through targeted temperature management, meaning like cooling them through medication and through icing and stuff like that, in order to resuscitate them and prevent brain damage. So that's what I want to do with cancer patients. But I'm going to try to bring in health equity into it. So maybe I could have a kind of sampling of inner city people, Um, so I'm going to see if I could work that in. But obviously, once I want to obviously research and publish in that field. So when I'm professor of nursing at University of Pennsylvania, yes, I'll be teaching like oncology nursing and heart conditions, stuff like that. But I'll probably do a lot of research on health equity. And University of Pennsylvania is in the city of Philadelphia, so that's like my hometown. So I could probably do a lot of that. So that's something like that I'll do probably 10, 20 years from now. But but right now, I'm at Virginia Hospital Center, so you're stuck with me. Obviously I hope to win in November 3rd. Then I go to Congress, which is just stone throws away. I could continue living in Arlington. It's like close. I don't even have to move, which is the greatest thing. And then I'll work to save America from COVID-19 and other things that are happening. So you kind of need to vote for me if you want America to survive. But but if you don't vote for me, that's fine. America, may not survive. There's nothing in the rule books of nature that says America has to survive. Wherever I am, I'm going to be faithful to God, and I'll be serving people as a servant leader. If you vote me in for U.S. Congress, I go to Congress and save America. If not, I don't go to Congress. America probably will not be saved. You need a Leonardo da Vinci in there right now, because I don't think establishment Republicans, establishment Democrats know what they're doing. I see America completely collapsing, unfortunately. Because during times when the economy is good, everything is good, even idiots can run Congress. But when things are collapsing all around you, you need somebody like Leonardo da Vinci of 21st century in there, or the country may not be saved. So you're grappling with that danger. So, if you want to save America, vote for me, Heerak Christian Kim, independent candidate for U.S. Congress for Virginia's 8th District. I don't care whether you vote for me or not. I mean, I do care. I want to save you and your family, and I want to save America. I'm patriotic to America. But if it's not God's will, I don't mind. If you don't vote for me and I don't get elected, that's fine. I'll continue being a nurse at Virginia Hospital Center. I'll be finishing up my dissertation on education. I was doing full-time nursing program at Georgetown, and I was doing full-time doctorate in education at the same time. Now my nursing education at Georgetown is over. I'll be working at Virginia Hospital Center, and soon my doctorate in education will be over. And I'll be applying to doctorate in nursing. I'll be working full-time wherever I am, as a congressman or as a nurse or whatever. But anyway, if I don't get elected in November, it's your loss. It's America's loss. But I'll work hard at Virginia Hospital Center, and I'll be due diligence to save your life if you become my patient. So there's no stress. Obviously, I hope you vote for me because I want to save America. But I march for life, whether I'm at Virginia Hospital Center or at U.S. Congress. Obviously, I can save more lives as a congressman, because I'll be setting policies for 330 million Americans, and you need me to save 330 million Americans. But so the way I see it, if God wants to save 300 million Americans, God will make sure I get elected. If God doesn't want to save 330 million Americans, then I won't get elected. That's how I see it. Because I don't see the current Congress saving America. And no offense to anybody. As I said, when everything is good, when everything is running hunky-dory, even idiots can run Congress. But this is not one of these times. there are a lot of brilliant people in Congress, but there are a lot of idiots. Um, and there certainly isn't anyone like me. So, that's why you need me in Congress. Um, yeah, and we need to end corruption in the Republican Party and the Democratic Party. Because right now, establishment Democrats, establishment Republicans, there's a lot of corruption there. We need to clean up the corruption. This is not time for all that corruption. Our country is collapsing. I mean, we have over 50 million Americans unemployed. It's going to get worse. Sorry, President Trump. I mean, I hate to be the bearer of bad news, but I mean, obviously, I want to get elected to U.S. Congress, work with you, President Trump, to save this America. As long as you oppose LGBTQ, I'm supporting you, President Trump. I'm voting for you. I'm telling everybody to vote for you. So, I see eye to eye with President Trump on many things. I would say in Congress, I see eye to, in Washington, D.C., I see eye to eye with President Trump the most, and more than anybody that I know. That's why I feel like I could work with President Trump to save our country. I believe that President Trump has done a very good job during the coronavirus crisis. Obviously, he made some mistakes, but who wouldn't? But I would say overall, he's done amazing, amazing things to help us survive so far. If we had Hillary Clinton, my belief is we would have had over 1 million deaths so far. So, yeah, I mean, obviously, it's a speculation because Hillary Clinton isn't president, thank God. But I think looking at how she handled a lot of different things, yeah, I think she would have really botched up leadership. President Trump has done well. I mean, he loves the American people, and he's worked hard in his own capacity to try to help Americans. That's something you can't deny him. He loves America. Certainly far more than Hillary Clinton or Joe Biden. I get the feeling like Joe Biden and Hillary Clinton love China more than America. Yeah. And that's a problem, I think, with establishment Democrats and establishment Republicans. I get the feeling they like China a lot. And, fortunately or unfortunately, China is our enemy number one. And that's how China sees us. We're at direct conflict with each other, China and America. It's going to head to a war at some point. Yeah. So I personally think it's better to fight a war with China now when we can win in conventional warfare, because I don't think China will use nuclear bomb. We'll just fight a conventional war. I think we can win that. And I think whether we win or draw in a war, we can damage China's economic, political, international infrastructure enough that we can survive as a country, even if we don't win the war. Because, I mean, right now, our country, for the foreseeable future, will be suffering from COVID. And so we're going to get weaker and weaker. It's guaranteed. China has no problem with COVID-19. It's not suffering at all. So it's going to get stronger and stronger. So at a certain point, we're getting weaker and weaker. They're getting stronger and stronger. The gap is going to increase. At a certain point, we will not be able to win a conventional war against China. That's why I think it's better to find an excuse, whether Iran or Taiwan, whatever, it doesn't matter which country, North Korea, South Korea. I think it's better to start a war now with China to kind of cripple their advance and infrastructure. Because the problem is, because China and America are the enemies, if they become superior to us and we become inferior, then it upsets the balance of power, and they're going to invade us anyway when we're when we're too weak. So war is going to come whether we want to or not when we're weaker. You see what I'm saying? So it's better to start a war now when we're actually a little bit stronger than China now. So it's better to start a war from the position of strength than wait until we start getting weaker and weaker through COVID, economically weaker to start, then China's just going to invade us and take us, because we won't be able to win a war then. So obviously, military option is one option. Another option is economically destroying them, which President Trump has been working hard on. And he's been very successful at it. And that's why I'm saying China used their COVID-19 as a biological weapon, because they felt like if they don't deploy their weapons of mass destruction in the form of COVID, President Trump is so good as a president that I think they foresaw like their country would not survive economically in economic competition. Their country would become like Japan. You know how Japan used to be like almost stronger than us, and then suddenly its economy started dropping. So Japan no longer posed an economic threat to us. And I would say thanks to President Ronald Reagan and President W. Bush, who's the vice president, who carried on the tradition of President Reagan. It's kind of like if President Pence becomes president, he will carry on the tradition of President Trump, right? Yeah. So I mean, my argument is we need to weaken China by any means necessary to maintain the balance of power. Obviously, you could do that economically. It's a little bit hard to do that right now because we have COVID, right? Because when we didn't have COVID, we were able to do that, use economy to weaken China, so we didn't need a war to become dominant. And President Trump was amazing at it. He was very good at it. Probably the best out of all the presidents we had. But now that we have COVID, that route is no longer available, unfortunately. There are other ways to isolate and weaken China using diplomacy, but that's not going to work very well because Europe is kind of pro-China. Africa is kind of pro-China. Canada is kind of pro-China. So a lot of Asia is pro-China. Middle East is kind of pro-China. So it's hard to minimize China from a diplomacy angle. So what other options do we have? It's military option. I mean, I hate to propose a military option to you, but there's a chance that we are going to become very weak. So it's possible China will invade us with their army. And it's a communist dictatorship. They could enlist young people to be soldiers. They could order that by law. So they could easily create an army of 100 million overnight. And I think U.S. Department of Defense, Homeland Security must game this scenario out, Pentagon, the scenario of Chinese invading us with 100 million foot soldiers. They need to game out a scenario where they're going to come and attack us. I think that it will be like you have 100 million people. They're building ships right now, I'm sure, ways to deliver the soldiers, planes, ships. So it'll be ubiquitous. So my picture of how China will invade us, it will most likely be conventional. You saw what happened in Lebanon. My theory is that China did that to test out a game theory, a war game theory, war game scenario, and that's how China will attack us. It won't be nuclear because obviously China doesn't want radioactive land because they want to colonize and occupy us. So they're not going to use a nuclear bomb. So they're trying to figure out how they could detonate a bomb that has the power of nuclear bomb that will destroy the city completely, incapacitate it, but it won't leave any radioactive residue so they could immediately occupy it. So that's why I'm thinking what happened to Lebanon is a practice round by China on real scenario setting. Obviously, you're not going to be able to prove it. So we have to use social scientific approaches to see the possibility of that. If I am correct in my theory, then Chinese invasion of America is not far off, meaning it will happen in the next couple of years. COVID-19 is killing a lot of people. It killed 2,060 people, and the death rate is going to go up. My theory is we're going to have like 10,000 deaths per day in the summer sometime. I hope I will be wrong, but I may be right. Um, and I'm predicting that we'll have like 1 million people die during the flu season per month. And then we'll have about 30 million Americans dead by end of year 2022. And if that happens, I'm saying that China will invade us in year 2022 with its force. And looking at what happened to Lebanon, more details are kind of becoming part of my theory. And that is China will probably use that model, whatever chemical substance that was used there. They're going to use that in New York, Washington, D.C., Boston, major cities, to incapacitate it. Because, when Chinese came down to Korea, they killed a lot of civilians as well, during the Korean War. So we can understand like the Chinese Red Army strategy. I don't think they will have any problem killing a lot of us civilians. I think what they want to do is weaken America before they invade. So my guess is there will be, bomb material that is made out of this material that we saw. They'll be either detonated on the spot. It doesn't have to come in the form of a missile. So they could be building this up in some warehouse somewhere in Washington, D.C., New York, Boston, right under our noses. They just detonate it from there, and then what we saw in Lebanon will happen in every city in America. And nothing is nuclear. Radar cannot detect it because there's no missile involved. And the material that was used in Lebanon is fairly common. It's like a fertilizer material. So no one's going to really be able to detect it. It's easy to transport. It's easy to store for the communist Chinese in like China, Boston, like Washington, D.C., Boston, Philadelphia, New York, Providence, Rhode Island. It's easy to store. You could just store it in a warehouse, detonate it, the whole city is destroyed. And in Lebanon, they're saying the blast shook the foundation so much that a lot of the buildings, the structure itself is unstable. So they may not be destroyed right now. They may be standing, but it could collapse in the future. And I believe that's the method the Chinese will use when they invade America. They will use, I guess it was ammonium nitrate, common fertilizer material in every city in America, detonate it. And then there's chaos. China will invade with their 100 million soldiers, and then they will station like 1 million soldier per state. So that's 50 million soldiers, and they'll run the city from there. It's kind of like how we utilize the National Guard to restore order. China will be using their Chinese Red Army to organize cities and societies. Yeah, so that's my theory, and I think that will happen. So I'm trying to prevent that, and obviously, and that's why you need me in U.S. Congress. We need to take steps to ensure that this doesn't happen. We need to give guidance and direction to Homeland Security, FBI, National Security Agency to prevent this from possibly happening, right? Pentagon. So you need somebody like me, Leonardo da Vinci of 21st century, who go in there, anticipate what's coming, put structures in place to make sure that doesn't happen. That's what you need. That's what I'm saying. Right now in Congress and Senate, I would say there's no one there right now who can anticipate and take the steps to neutralize. I think President Trump is genius enough to be able to do that, but he does need support. And he sometimes makes mistakes because his advisors, not as visionary. So, yeah. So that's an issue right now. I know you're thinking China invade us, but that's where people are thinking during, Pearl Harbor. Nobody thought Japan would invade us. They did. So I would say, watch the movie Pearl Harbor if you haven't seen it with Ben Affleck. Yeah, it can happen. Oh, sure, it can happen. Um, I mean, it's possible from a structural, strategic perspective. They could carry this out. They have the necessary tools to do it. Excuse me. Um, our deaths are at 159,990. This is summer. If 2,000 people die per day, in 10 days, you have 20,000 people dead. In 20 days, you have 40,000 people dead. In 30 days, you have 60,000 people dead. If we go at this rate, I'm saying it's going to increase to 10,000. Let's see. I hope I'm wrong, but it's increasing, as you can see. Confirmed cases are actually decreasing, or it's staying about the same, around 60,000. So we're at 4,877,115. Yeah, yeah, it's bad. It's bad. Um, I'm trying to close down all the schools and especially colleges, because once you open up colleges, you have students from different states coming to your college. And you're looking at like Boston is going to be a city of death during flu season. Literally. There's going to be so many people dying in Boston and Massachusetts. Yeah, I feel bad for Massachusetts. It's going to have massive deaths. When you have students coming from different states, you're making the whole state into like armpit of America in the sense of COVID-19. You should like Massachusetts governor should order that all the colleges shut down, or go online, because if he doesn't, everybody in Massachusetts may die. I mean, we may have like half the state die from COVID. Um, well, yeah, you'll see what I mean when the flu season comes. Because once you open the Pandora's box, you cannot put it back. Once all the students arrive in Boston, it's too late. It's too late. You cannot do anything to change the course of your destiny at that point. Only time you can do something to change the course of destiny is now, before the students come to your state. Yeah, once the students arrive bringing their COVID-19, it's too late. Yeah, the only thing you can do is try to minimize death as much as you can. But millions can die in the state of Massachusetts. Because they have like 500 colleges, in Boston area alone. But that's central. Now let's look at the world. United States is number one with 4,877,115 cases. Obviously, during the flu season, that's going to go up to like 20, 30,000, 20, 30 million, maybe more. Deaths are currently at 159,990. So death rate is at 3%. I'm predicting obviously 1 million people will die per month during flu season. So the death rate will go up to, like a few million. You can see that it's beginning to happen. We have no flu right now. Look at what's going on. 2,060 people are dying. I told you 2-3 months ago we're going to have massive death in the summer, did I? I'm always right. I mean, geez, it's a curse being a Leonardo da Vinci, but I use evidence. It's not like I'm just guessing here. I'm an expert. I'm expert of history. I'm expert of Jewish studies. I'm expert of theology. I'm an expert of education. I'm an expert of healthcare, having been trained at Georgetown University for 2 years. I bring all these expertise in my analysis. I use documentation. I use data to make my analysis using my critical apparatus, which is my brain, which is a superior developed brain. You need my brain to understand what's going on. Um, so it makes a lot of sense. It's not. I'm not shocked by this because I predicted this. I said we're going to have a lot of death in summer. Just go and see all the reruns from April 2nd to now. So I'm not surprised that I'm right. I use data to make my analysis. That's what I do. I'm a researcher. I don't just guess. I have a reason and evidence for everything I say. Brazil is number 2. They have 2,912,212 cases. Their death is at 98,493, 3% death. India has 1,964,536 cases. Their death, look at this, India. My heart bleeds for India because India is going to have millions of people die. They're headed there, right? I mean, look at that. They're already 40,699. I mean, geez, obviously India is the main enemy of China in Asia. So it looks like China deployed their COVID-19 weapon against India because nobody's dying in other countries. Nobody's dying in Pakistan. It's like India. Same genetic makeup, same race, same food, same climate. How come nobody's dying in Pakistan? Because Pakistan is close friends with China. But India is looking at, it's number 3. You should expect 1, 2, 3 to hit million, right there. I think everybody in the world expects America, Brazil, India to hit 1 million deaths. I think most people will be surprised if they don't at the current rate of infection. Now, Russia, Russia is getting a little bit dangerous there too, but its cases are relatively small. So Russia is, not in the danger zone yet because their cases are not rising in an exponential way. It's rising kind of steadily. It's a big nation, but death rate still remains fairly small. It has 870,187 cases, 14,579 dead. So, I mean, I would be a little bit worried if I were Russia. But, you have to think of it this way. Put yourself in the shoes of China. Their question mark is, can we trust Russia, right? If you're Chinese Red Army, you want Russia as an ally, but you don't want Russia to be completely virus-free. You want them to be a little bit worried. So, that explains why China has more cases, whereas like Korea, China doesn't fear Korea. China doesn't fear Korea or Japan, or also, obviously, it wants to survive. So if it spreads COVID in China, in Japan and Korea, it could come to China. We have the same genetic makeup as the Chinese, right? So obviously China has self-preservation interest because we're basically the same race, Chinese, Koreans, and Japanese. So if COVID spreads in China or Korea or Japan, it could spread in China. So I'm sure they're modifying their COVID to ensure minimal spread among Asian race because it wants to survive, obviously. So they'll probably target, race that's different from Asian race because you could genetically modify viruses, DNA structures to target certain population. It's like medication, but it's like opposite of medication. But medications target certain things, right? You know that, right? Medications target certain areas of your body. So you take the pill, it targets certain areas of your body. Um, yeah. Um, Medicine on one level is a smart weapon, right? You have bacteria or virus in your system. You take a medicine to kill the bacteria, right? So somebody who has tuberculosis, they get 2 years of medication to target tuberculosis bacteria, right? So it's like a smart weapon. Um, yeah. South Africa is number 5. And they have 538,184 cases, 9,604 deaths, 2%. See, most of Africa is not spreading at all, right? Obviously, South Africa, there's a lot of white people. That may explain why COVID is spreading faster. Because if COVID-19 is made to target like Ashkenazi people or white people, because there are diseases that is predominant among like Ashkenazi or white people, then it kind of explains it. So if you have any blood, genetic makeup, racial mixture that has white blood, it's easier for you to die from it um, than if you don't, right? Like obviously Korean, Japanese, and Chinese, they don't have any white blood. Africans in Africa don't have white blood, except like maybe, even in South Africa, they don't, not a lot of Africans have white blood. So death rate, spread cases are low in Africa. South Africa, you have a lot of white people. And recently there have been kind of intermarriage. Yeah, so I mean, obviously virus can be programmed to target certain genetic makeup. That doesn't mean like even if you're a different race, you may not get it. You can still get it. It's kind of like certain diseases are supposed to be predominant among Ashkenazi or white people, but sometimes black people get it, sometimes Asian people get it. So there are always exceptions to the rule, but exceptions prove the rule. You know what I mean? Yeah. So, yeah, scientists say COVID-19 may be forever in society, school, work, business, shopping, everywhere in the US. Good old days are when a lot of beautiful women were everywhere, ubiquitously. Yeah, but now because of COVID-19, they have to stand 6 feet apart, unless they're like their family, or if they don't care if they get COVID, then they don't have to. Yeah, but if you're going to be close together, you'll probably get COVID. You got to expect that. Yeah, so I have 3 articles for you. And the first article is from May 22nd, Yale School of Medicine. And the title is COVID-19 Can Stay With Us Forever by Patricia Brunetto. The relevant quote for that is, there will be a vaccine, there will be different cures, but it will not be completely eradicated. A model of HIV, AIDS, or tuberculosis. The coronavirus epidemic makes this possibility easy to imagine, says a professor of medical history at Yale University in the United States. An important thing about historians is they've studied different pandemics in the past, right? So they can give you a perspective, a historical perspective on it. That's why historians, medicine historians are very important, especially when you're dealing with a pandemic that you're not used to and you don't know much about. And even now, experts do not know much about COVID-19. Yeah. So so you have to expect COVID-19 to be with America forever. So In order to survive this, you have to train your family to be in a social unit with each other. So, yeah, I mean, parents should try to work at home 100% of the time. Children should study at home online from pre-K to college, graduate school. Stay at home with your parents. And that's important for many reasons. Number one, because you don't want COVID-19 to spread. Number two, your parents can die from COVID if they're over 40, easily die from COVID if they get it. So if it becomes empty nest where only your mom and dad who are over 40 are living in the home, chances are they're going to die. That's why if you're a college student, you should stay at home with your parents and take the class online. Because if both of your parents get COVID, you need to be there to feed them, do the shopping, do everything so that your parents can survive. Because how they're taken care of at home will have a direct impact on whether your parents live or die, right? So it comes down to you. If your parents over 40 gets COVID, their chance of dying is very high during the flu season. If you're at home and not at college, off somewhere, if you're at home, you can take care of them. You could buy stuff, food, you could do all the chores. They could just relax and rest in their bed. The chance of surviving is very high. Not very high, very low, but it's higher than if you weren't there. You got to remember, you have to anticipate hospitals running out of beds, and some of the patients will be sent home to die. So think of that about that scenario. Your parents can be sent home to die because hospitals are full. You're there, you can take care of them. Especially if you're 18 or 19, 20, you're at the healthiest stage of your life. So the chances are, you can help them. You may get COVID, but it may not be that bad for you. I mean, it could get bad for you, especially if you have asthma or diabetes or whatever. But still, without you there, your parents' chance of survival is like zero. With you there, the chances of survival is higher. That's why I'm saying if you're a college student, you should stay at home. Don't meet and socialize with your other friends. You're going to bring COVID back home. That goes for all you young people, middle school kids, elementary school kids. Yeah, you have to socialize under the social unit of home. If you want to talk to your friends, do it over Zoom or phone, Skype. Don't meet physically. That's how COVID spreads. That's the best chance you have of surviving COVID as a family. You stay together, don't socialize with other people. Father and mother should create programs for the whole family. It's like planning activities in a yacht or cruise. You need to plan your days out very well. Because this can be here for 10 years. So get used to it. Transition to 2009, COVID-19, 2020 America. If you have money, try to retrofit your house to have negative pressure system so they sucks out the viruses. Because hospitals create rooms with negative pressure to suck out viruses. You still have to wear a mask. You can still get COVID in negative pressure rooms, but it's safer. Safer, but it's not 100% safe because you still have to wear a mask. But yeah, safer is always better than less safe. So if you are a millionaire, billionaire, retrofit your whole house to have negative pressure rooms. Yeah, that's a priority. Especially if this is forever. I mean, you get good money use out of it. right? Because you have to run the negative pressure system 24/7, 365 days a year for 10, 20 years. Yeah. But that gives you a higher chance of survival. So if you have the money, spend it, use it, make sure you negatively pressurize every one of your rooms, your whole house. See what kind of advice I give you that you can survive? Because there are ways to do things to help yourself survive. But if you don't know what to do, you cannot maximize your survival potential. That's where Heerak Christian Kim comes in. I give you guidelines on how you can survive. And it's far better than CDC. That's why you need to watch this show every day religiously. Tell everybody to watch this show. Um, Second article. 5 ways COVID-19 will change higher education forever and how colleges can adapt. Obviously, you have to adapt to survive. COVID-19 is forever. If it goes away, that's a miracle. Miracles don't happen every day. So just assume that COVID-19 is forever. That is the safest way to live. There's no reason why it will go away. Why do you think it will go away? We know COVID-19 mutates, which means you got COVID this year, you could get it again next year. Which means COVID-19 will never die. It won't disappear. It's not a seasonal virus like flu virus. It's a 365 days a year virus, which mutates. You could get it over and over and over again. Expected. You may not die in this cycle when you get it, but you may die in the next cycle when you get it. That's why I try not to get it. Yeah, so the relevant quote from USA Today, article by Adam Weinberg from August 4th is, the coronavirus pandemic is changing higher education. Campuses are closed, students are taking classes online, and the number of colleges announcing budget cuts and furloughs is growing. Students, faculty, staff, families, and others are wondering what comes next. It's a transformative movement for higher education. My recommendation is just go 100% online for the foreseeable future that COVID is there. But if you insist in trying to use the buildings, or maybe you don't have a choice because there's a medical school or nursing school where you have to like work with patients, although if you could do it remotely, that's always great. Then you need to negative pressurize every building and every room. It's going to be very expensive, but even with that, you need to wear a mask. Even in negative pressurized rooms, you have to wear a mask, but that's absolutely necessary. So while there's nobody on campus, this is a good time to negative pressurize every building, every room. This is a good time to do it because there's nobody there on the campus, right? So if you have some excess cash, negative pressurize every single room in your college campus. If you anticipate bringing students back, I mean, you don't have to bring any students back. For the next 10, 20 years, you could do 100% online, right? So if you assume that you're going to do 100% online during COVID-19, then don't negative pressurize your buildings because you don't need to spend the money on that. But if you anticipate bringing students back during COVID-19, then obviously you have to negative pressurize your rooms because even with a mask, COVID-19 spreads. I mean, my recommendation is plan on not bringing students back ever until, as long as coronavirus is there. Or we have U.S. military develops a mask that we can use with close to 100% safety for long periods of time that is user-friendly for citizens. Otherwise, don't anticipate opening the classroom in the next 10, 20 years. Yeah, I mean, you need to start focusing on developing respiratory system that's next generation, that's lightweight, doesn't use clunky filters because, filters can get dirty and infect you with other things. Because you can get pneumonia from clunky things that stick to the filter. Yeah. Your mask can give you pneumonia. You could die from that pneumonia. I mean, yes, you could die from COVID-19, which gives you pneumonia, but you could also die from a clunky mask with clunky filter. You could get aspiration pneumonia, and you could die from that too. So we need to create a respirator that's not going to give you pneumonia. That's next generation. You see what I'm saying? Um, because you could die of aspiration pneumonia. That's a thing. Yes. You know what aspiration pneumonia is? You breathe in dust particles, and the dust particles infect your lungs, and then your lungs become uh, infected, and pneumonia sets in, and you die from that. That's called aspiration pneumonia. You could also die from aspiration pneumonia. It's like, you have food, and then, reflux come up, acid reflux. Part of the food comes up when you're like hiccuping or whatever. And then it goes inside your lung, and it comes up. Instead of coming out of your mouth, it kind of goes back down, but it goes back down to wrong tube, to your lung tubes. And then your food particles from your stomach that has acid attached to it, obviously, stomach acid, goes into your lungs, damages your lungs, and then you get pneumonia and you die. It's called aspiration pneumonia. So aspiration pneumonia can be like you breathe in like dust particles or paint fragments, or in the construction sites, right? You have like little particles floating around. That could go inside your lung and infect it. That could be aspiration pneumonia. Or aspiration pneumonia can be like food particles from your stomach coming up and going down the lung. That's also aspiration pneumonia. You could also get aspiration pneumonia if you eat food and instead of going down the right esophagus to your stomach, sometimes food goes down your lung. If you're old, like 40, 50, 60, the food that goes down to your lung can infect your lung, and then you get pneumonia from that and die. And that's called aspiration pneumonia. So there are 3 ways to get aspiration pneumonia. Oh, the fourth way. Fourth way is you wear a mask with a filter system, and the mask itself has, it's not very clean. So the mask itself may have bacteria on it, and that could go down when you're breathing it in, and then it could go down to your lung, and then that could develop into pneumonia, and you could die. So these are non-COVID ways you could die, aspiration pneumonia. I'll share with you other ways you can die. As you know, I'm a healthcare expert. Basically, I, I'm graduating with my master's in clinical nurse leader from Georgetown University. I did this from summer 2018 to summer 2020. My graduation is in August. My program is basically done. Yay! Congratulations to me. My last clinical was on Tuesday, so I'm done. I'm done. Yay! Heerak is done. Heerak is finished. Heerak is finished, and he's out of here. Out of here. Yeah, so I am out of here. I love Georgetown. I'm gonna go back for special lectures and stuff like that. Obviously, I love all my Georgetown University professors. So I'd love to see them again. So obviously, Virginia Hospital Center is like less than 5 miles away from Georgetown, so I can go to all the special events and everything. Yeah, so it's good, and who knows? Maybe like in a few years, I could even, I mean, if I don't get elected to U.S. Congress, which I hope I get elected, obviously. But let's say, I don't get elected and I keep working at Virginia Hospital Center. In a couple of years, I could actually become a clinical instructor at, maybe for Georgetown University or Howard University nursing students, at Virginia Hospital Center. Who knows, right? I'm really good at teaching. Students love me. So, yeah, but who knows, I mean, I don't know what God wants me to do. I follow God's call. So if God wants me to be U.S. Congressman, then I'll be a U.S. Congressman. If not, I'll do nursing. But I feel like God's been leading me in this direction to be a nursing student because he knew that COVID-19 was coming. I did not. Right? So God probably put me in nursing school for this precise reason, to be your savior. I don't want to say your savior. That sounds so bad because Jesus is the only true savior of the world. But you know, but you know, as a grace of God to you. So you know, I could be less. I would be less useful to you if I were just like doing Jewish studies, right, at University of Pennsylvania, teaching Jewish studies courses, right. But because now, you know, I've dedicated 2 years of really incredibly difficult study time, like study, 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 study. 25 of you who are in my cohort know what I mean. Study, 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 right? That's you, that's me, that's everybody. So congratulations to us. Pin, 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 pin. Yay, 25 of us were pinned. So, yeah, so, yeah, unfortunately, you know, I'm predicting 5 to 10 of us will die by Christmas. This is COVID-19, it kills. Yeah, so let's celebrate while we have. I hope you go to the beach and have fun because you may die before Christmas. You know, don't miss out on fun. Don't miss out on fun, my fellow court members. Go to the beach and have fun. Go to the beach with your family and have fun. Yeah, just don't go with strangers or other people who can give you COVID. But yeah, go to the beach with your, you know, immediate social unit of your family and have fun. Yay! Yay! Have fun! Yay! Yeah, because you know, five to 10 of you, you know, I know all of you are watching this show. Everybody watches this show. You know, this show is like probably the most popular show in the world now. But yeah, so 5 to 10 of you are gonna die. I'm hoping you won't die. I hope none of you die, but I'm predicting that 5 to 10 of you will die because you shared, you know, in the class that you know, you have asthma or allergies or whatever, which means you're gonna probably die. You're on my list. I don't want you to be on my list, but my list is objective. It's not biased. It's just my list is filled with people who are, you know, either have pre-existing conditions or overweight or are old. Those, I don't want to use the word old, but older. You know, that's like my death list. So you could imagine who's in the death list. I mean, all of us, we're like a family. We know each other. So you all know what I know about each other, right? So you could imagine who's on the death list, 5 to 10 people who may die before Christmas 2020 if they work in a hospital. I know some of you said you're not working in the hospital, you know, like immediately. I guess you're waiting like 6 months or whatever, or maybe a year, trying to wait this thing out. But if this COVID-19 is forever, you know, it's forever. I mean, unless there's a vaccine, right? If there's a vaccine, then, you know, situation becomes different. There's a cure, situation becomes different. If the U.S. military develops a respirator that's not going to give you aspiration pneumonia, or, you know, it's close to 100% foolproof, then, you know, situation is different. So, you know, maybe waiting out 6 months could pay it off. But I figure, you know, yes, it's true. When we started nursing in 2018, nursing was the safest profession. Like, you can't die from nursing really, unless like you stab yourself with a needle by mistake, and it has like, you know, HIV virus or you know, some kind of virus, you know, that doesn't have a cure. Yeah, I mean, it's the safest profession in the world in 2018. Now it's the most dangerous profession in the world. So yes, you did not anticipate this. So I mean, I understand where you are, but I'm happy to start work. I'm starting work on Monday, August 10th, 2020. You will see me in Virginia Hospital Center. Yay! Yay to me! Yay to Virginia Hospital Center! I'm so excited about starting work in Virginia Hospital Center on Monday, August 10th. I mean, I'm done. I'm out of here. I am out of here with you know, Georgetown University. I'm finished with everything. I'm so excited. Yay! Congratulations to me. You know, I worked so hard. I worked like a dog for 2 years. I worked like a dog. I mean, that every one of us worked like a dog. All 25 of us. It was so hard. Oh, you know, one of our core members, she shared with us that she flunked like 2 pathophysiology exams, and she's like one of the smartest women, that I know. And she like flunked two, and she literally flunked 2 exams, yeah, in a row. And she's like a straight A student, you know. So you can imagine how hard this program is. I was like so worried she'll flunk out. This was in the first semester, you know. So I was like, oh, wow, I hope she doesn't flunk out. She's really nice, and so I didn't want her to flunk out. So I was like, hoping, she wouldn't flunk out. And she passed the 3rd exam, and she passed the 4th exam. It was high enough that it balanced out for her to pass. I'm like, thank God. Um, yeah. So hi, she knows who I am. I mean, she knows who she is. But yeah, I mean, all of us do, all 25 of us, because she shared openly with us. But I guess since she passed, it's like old news, right? So it's not like no big secret, but but anyhow, anywho, yeah. But yeah, it's a hard program, but it's worth it. But yeah, it's hard. There are cohort members who said they just like while they were taking a shower, they just plopped down on the floor and just crying. They had like a breakdown. I didn't have a breakdown. I mean, I tell you it was hard, but yeah, I just like plugged at it, worked hard, just kept going. But yeah, some of the core members shared with us that they broke down in like middle of a shower, just started crying uncontrollably. That's how hard the program is. But everyone, we got pinned in May, pin. Yeah, so 25 of us survived out of 34. 9 people did not survive in our cohort. But it's a hard program. It's like very hard program. So yeah, yeah. So yeah, I'm excited to start working in Monday. Uh, I feel like I need the reason that I want to start early is because look at this, 2,000 deaths right per day right now, and it's going to increase. Can you imagine the flu season? We may have like tens of thousands dying during the flu season. So I want to go in there to Virginia Hospital Center, kind of get my bearings, learn the policies, you know, because I figure like starting October, you're gonna have a flood of people coming in from Virginia State District and from Washington D.C. area, Virginia 9th District, Virginia 11th District. You're gonna have like flood of people coming in with COVID. That's my prediction. So I want to start now, like August 10th. A couple of months, we may have increasing COVID cases. We had like 6 die with COVID like a couple of days ago in Northern Virginia. So the rate will continue to increase. We have like 30 people dying, 25 people died in the last 24 hours. The day before that, 30 people died in Virginia. So that rate is beginning to rise. But by the time we have October, I'm sure we'll have more than 300. We may have more than 300 people die per day, in Virginia. So that's why I'm saying I like to go there, get my feet wet, kind of learn the protocols. It's like orientation period in a way. I want to get the orientation out of the way before like COVID patients start flooding in. So that's why I'm happy to start like on August 10th. I need to get in there, and I submitted a study plan to Professor Elizabeth Schloss, who's co-teaching or co-directing basically our leadership practicum for the summer with Professor Dioma Yearwood, who's the chair of the nursing department, and Professor Schloss basically, I guess, managed the clinical, sides of the, like NCLEX exam, CNL exam. So I passed CNL exam like several weeks ago, and she was really excited about that. Professor Yearwood is very excited about that too. And now, so Professor Schloss guided us through that. So my success is your success, Professor Schloss. Hi, Professor Schloss. I'm sure she's watching this show. Everybody watches this show. Yeah. Yeah, and now I'm going to be taking NCLEX RN. And so I submitted the study plan to Professor Schloss, you know. So, I work full time, and then times that I don't work, I'm doing my NCLEX studies. So, I divided the times, Uh, so I have a good thing going here, going into NCLEX exam. Um, so obviously I anticipate passing, the first time I took my predictor exam, I had 99%. And so, with the study plan, there should be no problem passing this thing. So I'm excited, yeah, but yeah. So, Harry's like looking at me. Harry, look at me. What are you looking at? Harry's like, what a boy he is. But anyhow, yeah. Um, yeah, so it's higher education is changing. Obviously, for schools that are 100% online, like Chicago School District, Washington, D.C. School District, if you want to have your children return to classroom, you need to negative pressurize your rooms because most healthcare experts say this is going to be for years and years and years. Some say this is forever. HIV virus has been here like ever since we identified it. It's been here for decades. Still here. Obviously, it probably existed before we identified it, but and same with hepatitis B virus, same with herpes virus. None of them have a vaccine. Um, yeah. Obviously, you could do 100% online education with pre-K, pre-kindergarten to 12th grade forever. And I would actually propose that. We just need to adapt to 2020 COVID America. It's not in China, but we're not in China. We're in America. So we have to deal with things as they are happening in America. We cannot say, oh, Chinese are doing this. Oh, Europeans are doing this. So we could do this. We can't talk like this because we have to focus on us, America first. We need to survive as a nation. We need to keep our citizens alive. So we can't talk about other countries because other countries have different realities. Our country, we have this reality. We have to deal with this reality that we have. So yeah, it's no use talking about how China is, how Korea is, how Europe is. These are all non-relevant discussions. What we need to talk about is how is America, and in this situation, what must we do for our country in our country's current situation? That must be like 95% of our discussion. Um, yeah, the best thing that came out of COVID, though, I have to add, is my children. I don't have any children. I've never been married in my life. I hope that I'll marry one of these beautiful women who looks like that on the photo or behind me. Yeah, please, God. You know, God's like, I think God sees me as his servant. And so he's like sending me to do this, sending me to do that. I'm like, God, why can't you just give me a wonderful, beautiful, hot, amazing woman with pretty face and a nice body like that to marry and have a lot of kids with? I don't know. I pray and I ask God, but God, I think God likes having me around doing his stuff. So he's like, I'm like, gee, God, why can't you just let me have one of those? Like good Christian woman, one of those. But yeah. But I mean, I guess God has the other ideas, and which is like frustrating because I like women. I mean, I do go on dates, as you saw from my a bachelor in Poland. I dated like over 10 women in like 10 days. So I guess that's like blessing by God. I think God encourages me through that because every time I ask a beautiful woman to go out with me, they say yes. So most of the time, I mean, every time I've never really remember any pretty woman saying no. Um, so I guess that's like the way God compensates. So he doesn't give me a wife, but he lets me date all these beautiful women wherever I go. Yeah, but it's not the same God. That's what I say. You know what I'm saying? But so I'm keeping my fingers crossed. I'm keeping hope that God will send me a beautiful, amazing woman with a nice body. Because the most important thing in a woman is Christian faith. After that, it's beautiful body and face. Let's face it. I'd rather have one of those women with like no high school graduation, no high school diploma, than a woman who's like fat and ugly with 5,000 PhDs. Because I don't have to sleep with them and have sex with them at night. You know what I'm saying? You don't get married just to talk about ideas, you know? I mean, geez, hopefully, like, I don't talk too much with my wife. Hopefully, we're spending more time having sex and having kids. I mean, a healthy marriage is that you have a lot of sex and you're doing a lot of things together to raise the kids. That's a healthy marriage. Unhealthy marriage is you have no sex and all you do is talk. That's an unhealthy marriage. That's why New Testament says husband and wife should have a lot of sex. I'm paraphrasing. Um, if you don't have sex every day in marriage, there's something wrong with your marriage. Have sex. Stop talking, just have sex. Geez. I mean, what's more fun, talking or having sex? I mean, geez, you're married. Have sex. You know. Yeah. So, see sex as God's gift to you married people. It's God's gift. That's why New Testament says you should have sex. Like whenever man asks their wife for sex, you should give it. Whenever a woman asks God for sex, it's a marital duty. And act like you like it. Even if obviously you like it, but even if you like have a headache, pretend like you don't have a headache. Yeah. Yeah. More sex between husband and wife is what keeps the marriage happy. It's not that complicated, people. It's not that complicated. Most of the divorce happen because husband and wife are not having sex, right? You should have sex every day. Yeah. You're not too old to have sex every day. Now, let's go to the third article, how COVID-19 is changing consumer behavior. Oh, before going on to that, one of the best things that happened this COVID-19 is that my kids in Anacostia who don't have internet at home, who don't have laptop computers, like over 80% of them, now they'll get their laptop, now they get their internet. I mean, COVID-19 may be bad in many levels, but from the perspective of health equity, that's the best thing that happened. Like for technology equity, health equity, like education equity, because I'm in Arlington. Every student in Arlington public schools get like a computer for free. iPad, or I can't even purchase iPad because I don't have money. I mean, I'm poor. Probably like over 80% of Arlington is richer than me, maybe more. I don't have money to buy iPad. I took a $200,000 loan from George to study at Georgetown University for master's in clinical nurse leader. Over 30 years with interest accrued, that's like $500,000 I have to pay back. I hope some like billionaire will like just pay all my student debt. Please, Lord. But any billionaire out there want to pay off my student debt, please do so. Oh gosh, it's like $500,000 of student loan to pay. That's pretty, like I do feel the weight on my shoulders. But anyway, I did it for you, right? This nursing education, I'm doing it for you to save your life. Yeah. Yeah, Monday, August 10th. That's why I'm starting. Yeah, I am out of here of Georgetown, and I am in here at Virginia Hospital Center. Yay! Yay to me! Wait, yay to everybody in Arlington County and everywhere else who may be coming to Virginia Hospital Center. Yeah. So yeah, and so yeah. So from a education equity perspective, I'm glad that my kids at Savoy Elementary Schools will now have cutting edge electronic devices at home with internet that they could use and they could grow, and I always like I shared with you about how we have a computer cart that all of us teachers at Savoy Elementary School shares, and like half the computers are like not working. and it's so frustrating because these computers are like many years old. Um, and my heart, bleeds for my students who don't have access to computer, who doesn't have internet. Computers that we use at Savoy Elementary School, they're like really old, broken down. And now, my kids can have internet. They could access uh, important stuff like ebooks and learning modules to help them. There's a lot of stuff out there that can really help them. There are like free quizzes and math, that you can practice math problems on. And so I'm so glad that they have access to all that now. So, because DCPS, District of Columbia Public Schools, is forced to provide poor students with computers that they normally do not, because their education is 100% online. They have to buy computers and give them computer with internet. So on that level, it's the best thing that happened in America. Ironically, I have to say, COVID-19 may be the greatest thing that happened in America for education equity from pre-K to 12. Because we had educational inequity, because in Arlington Public Schools, every student has an Apple book. It's like a $4,000 computer. I can't buy it. I'm poor. I'm running for U.S. Congress because this is America. I believe that any U.S. citizen can run for Congress. You should too if you want. Yeah, run for Alexandria City Council. If you're in America, it doesn't matter if you just have a high school diploma. Run. If you're a retired police officer, run for office. Hopefully you're anti-gay marriage and anti-abortion like me, and pro-gun. If you are, run. If not, don't run. Yeah, a little political humor there. But anyway, yeah. So basically, I'm poor. I can't afford an Apple book computer. But in Arlington County Public Schools, everybody gets one for free. Yeah. But like 5 miles away, Savoy Elementary School is like 5 miles away. Nobody gets anything. They don't get iPad. They don't get Apple Book. Nothing. But because COVID-19 happened, they have to give them electronic devices. Do you see what I'm saying? And this is not just in Washington, D.C. This is happening in every city in America that goes online. Like Chicago public schools, I'm sure none of the students got Apple Book or like a computer to take at home. But now, because of COVID-19, because Chicago School District is going 100% online, they have to give every student a free computer with internet service. This is the greatest thing to have happened for education equity. I mean, U.S. Congress could have tried to pass law to make this happen. It probably would not have happened. Right? Now, everybody has a computer, like in Chicago public schools. They have to learn online. This is the greatest thing that happened for urban education in the history of urban education. Because now, at least we're going to have technological equity. Obviously, educational equity is a lot of things. It's not just technological equity, but we did not have technological equity for the past 30 years. But now we're going to have technological equity for schools that go 100% online. That's why I think this is a positive thing that's happening right now. Like Richmond Public Schools is going 100% online. And now they have to give their kids free computers with internet access, right? Which puts them technologically on equal level with Henrico Public Schools, which is a richer public school system, that provides more stuff for their students. Henrico is like in the suburbs area. So right next to Richmond Public Schools in the capital of Virginia. So I am saying this, in every tragedy, there are positive signs. Yes, COVID-19 is a tragedy. I agree with you. 2,000 people are dying every day. That's a tragedy. But from the vantage point of technological equity or education equity, it's the best thing that happened. for inner city public schools. Yeah. Because living in poverty generation after generation, that could be worse than COVID-19 death, to be honest with you. Like in Savoy Elementary School, in that Anacostia neighborhood, there are people who are living in cycles of poverty, generation after generation after generation, right? What COVID-19 is doing is it's providing an opportunity to create a more equitable education system, right? From a technological angle, that's true. Now it's going to be like 100% online platform delivery. So it's easier to provide education equity in online platform, right? As long as you're doing it right. So there are a lot of good things that are happening. Yeah, we'll see. I mean, they may fail the experiment, but I don't think so. Because all the teachers that I know from Savoy Elementary School, they're really good teachers. So when we're talking about education equity, there are several factors that we are considering. Technology, obviously, is one major factor. So that is brought up to par. So there are a lot of other things we can do to make sure that education delivery becomes equitable as well. So from that vantage point, COVID-19, as I said, may do more good actually than the civil rights movement. Yeah, I mean, the civil rights movement talked a lot about education equity, but it didn't really provide much of an education equity, right? From the civil rights movement in 1960 to now, education for Black students have been very inferior since 1960 to now, right? So that's like 60 years of inferior education for Black public schools, or inner city public schools with a lot of Black students. So civil rights movement did not really help Black education that much. Some argue that Black education before civil rights movement was superior. Some people argue that. Whether that's true or not, the fact is no one argues that inner city public schools did not get the money that they needed, had a lot of disadvantages, right? No one argues that. Technology, they were always given the worst technology, did not have the cutting edge technology. Everybody agrees with that. Since civil rights movement to now. But COVID-19 forced all the school districts which are closing to provide, modern day technology to the students. So in a sense, COVID-19 has done more than the civil rights movement in terms of how each individual student has access to technology that's cutting edge, and by extension to education equity. So it's irony, but maybe COVID-19 is a gift to inner city Black schools. Because obviously if we had no COVID-19, Black students in inner city schools will continue to have technological disparity, inequity. And that could continue for the next 2-3 decades. But now COVID-19 is forcing school districts to provide technological equity to poor students. And that's the right direction. They should do that when there's no COVID, but unfortunately people are not going to do it, right? And when Barack Obama was president for 8 years, he did not do it. He did jack for Black education. He did nothing for Black education, President Obama. Everybody knows that every Black educator, if they have to be honest with you, they will admit that President Barack Obama did not do anything for Black education specifically. How are you going to have education equity if you don't do something specifically for Black education, right? So so that's one of my criticisms of President Obama is for 8 years he did nothing specifically for Black education. He didn't focus on that at all. So technological inequities were not fixed, but COVID-19 is fixing the technological inequity. So from that vantage point, COVID-19 may be the best thing that happened in the history of Black education equity. Yeah. Yeah, I mean, it's sad, but it's true. As I said, you wish that people would do the right thing and provide all the technological devices that poor black students need in inner city, but that doesn't happen. States don't do that. School districts don't do that. There's just no money there. Um, yeah. It may be partly due to the property taxes. There are a lot of factors, but the result is they don't have the latest technological gizmo and things that they need in the 21st century America to be competitive from a technology perspective or educational perspective, right? And that's the important point. We need to bring education equity. That means they need latest technological access. So I'm saying COVID-19 is forcing city, states, educators to provide this to the poorest students in the school district or school systems. And so that's why I think from a vantage point of education equity, COVID-19 is the best thing that happened. It's even better than civil rights movement. Yeah. The third article is how COVID-19 is changing consumer behavior now and forever. And McKinsey and Company, they're a think tank consulting company. My roommate, Ty Tomasitin, who went to Philip Exeter, was in Pennsylvania Glee Club. His first job was at McKinsey Company as a consultant. He really liked this company. He worked there for 2 years and then went to Stanford for MBA, married a girl, Chinese girl. Ty Tomasitin is from Thailand. He married a Chinese girl who was at Stanford Medical School. And yeah, so yeah, he's a smart guy. It was a good roommate. And yeah, so August 5th, 2020. The article was by Victor Fabius, Sajar Kohir, Bjorn Timlin, and Sophia Murvad Varanen. Yeah, and the relevant quote is the period of contagion, self-isolation, economic uncertainty will change the way consumers behave in some cases for years to come, maybe even forever. Since they say COVID-19 could be forever. Now, new consumer behaviors span all areas of life, from how we work to how we shop to how we entertain ourselves. Yeah. Things has to change. Things have to change. Like we can't have team sports. This is not China. In China, nobody's getting COVID. Nobody's dying from COVID. But we are not in China. We are in America. In America, we have 2,000 people dying from COVID every day. We have to live in the realities of our own country. Whether my theory is correct or not, that COVID-19 is a advanced biological weapon of mass destruction created by China to destroy a country, whether you agree with the theory or not, the fact remains we have this reality where we have 2,000 people dying per day. China has 0 dying per day. China has 0 cases per day. We're not in China. We're in America. We need to live in the context we're in, right? Once we get to 0 cases and 0 death, we could talk about doing whatever, but we're not there. We are not like China. China has 0 cases, 0 death. We have 60,000 cases and 2,000 deaths per day. That's us. That's our reality. We need to live in the real world. Can I get a 5 on that? Can I get a 5? We need to live in the real world. We need to live in the real world. Yes. Obviously, Heerak Christian Kim, that's who I am, created this show to save your life and your children's life. Heerak Christian Kim, that's who I am, running for U.S. Congress in Virginia's 8th District against Don Beyer. So I hope you vote for me on November 3rd, 2020. Write my name into the ballot, as I've explained yesterday. I filed a lawsuit against Virginia Governor Northam and Board of Elections because I could not collect 1,000 signatures because Virginia Governor Northam issued the stay at home order from March 30th to June June 10th. I became independent candidate for U.S. Congress in March, and I couldn't collect the signatures because of the stay-at-home order issued by Virginia Governor Northam, and I requested Board of Elections, Department of Elections, to waive my 1,000 signature requirement because of the stay-at-home order. That doesn't makes it illegal for me to go door to door to collect signatures, but the commissioner, the highest person of Department of Elections, Chip Piper, wrote back and said he doesn't have legal authority to waive my requirement. So I wrote to Governor Northam, and Governor Northam did not write back at all. So I'm waiting and waiting for Governor Northam to waive my requirements because he's the one who issued the stay-at-home order, right? It's only fair. I'm just asking Governor Northam to play fair, but obviously he doesn't want to play fair. He wants to help out his Tom Bayer friend, Democratic Party friend. I mean, he's playing dirty, this dirty politics. This is what I'm talking about, like establishment Democrats. Um, so, I had to file a lawsuit, which I didn't want to do, but Governor Northam doesn't even reply to my emails, phone calls, letters, and doesn't give me a waiver. So I filed a lawsuit in Arlington Circuit Court on June 3rd to have the 1,000 signatures waived. So that's in the court system. We're going to have a case in September. I talked to the clerk of the clerk, because their offices are closed. We can't go there. And we could go there, but the offices are closed. So I talked to him on the phone, and he said, yeah, the trial will be like in September. So if my name is not on a ballot, like absentee ballot, just write my name in, Heerak Christian Kim, for Virginia's 8th District. It will be on the ballot, by November 3rd. But, I mean, if ballots go out, I mean, if you have absentee ballot, they may send you the absentee ballot before my name is on the ballot. Because the trial is like, what? The court date is supposed to be like in September. I guess there's a COVID and everything. And, I guess COVID is complicating everything. So everything is like pushed back, unfortunately. Yeah, but yeah, so yeah, but yes, I am an official candidate for U.S. Congress of Virginia's 8th District, and I think I could beat Dunbar without any problems. I think you need me in Congress to save you and your children. So obviously, if you want me to save you and your children, you vote for me. Yeah, but yeah, I mean, consulting companies, they're predicting based on their research and evidence. I mean, obviously, people don't shop and entertain themselves in the same way. I think the era of professional sports is over. Um, it's unfortunate. We just need to develop new forms of entertaining ourselves that is COVID-19 friendly. Unfortunately, professional sports is not really part of that. I guess you could try to adapt it. I mean, if we ever go down to 0 cases and 0 death, then yeah, I mean, yeah, bring back the professional sports. But we're not there. We're not China. We're America. And I'm proud to be American. I'm proud that I'm not Chinese, like citizen of China. So, yeah. Anyway, yeah. So I hope you go to the beach. Have fun swimming with the fishes. Because, winter time, there is going to be no fun. You're going to be locked away in your home with nothing to do. There's going to be no movie theater. There's not going to be no bowling, no bars, no restaurants, no cafes, no bowling alleys, nothing inside. Probably malls will be all closed. Yeah, there will be nothing open. Yeah, just think of yourself as living like in the Stone Age, except you have your computer and stuff, you have entertainment at home. You can get like, Nintendo and stuff like that. And play video games at home too. But yeah, board games, I would say don't play video games, do things, play video games with your kids. do things with your kids and family. Find healthy entertainment. That's if you have a backyard, open up a garden. But right now it's not winter, so you should take your children to the beach tomorrow. Have fun. Geez, this is the time to have fun. There's fish swimming, go fishing. Yeah, don't miss out on all the fun when you can have fun. I mean, there will be a time a few weeks from now where you cannot have any fun at all. No fun, not a single amount of fun can you have. A few weeks from now, that's coming. So make sure you have fun now when you can. Jeez, don't just like mope around in your neighborhood. You have kids, take them to park, mountains, drive to a mountain. They're like nice mountains in West Virginia. Start out early on Saturday, go to a mountain, go hiking. Um, yeah, I mean, do something. It's nice and warm. You can't go hiking when it's snowing and cold, right? So yeah, spend this time with your kids, your family. You may die before Christmas, as you know. So you got to make this summer count. So go and do a lot of fun things. Make sure you're wearing a mask around other people, and try not to talk to other people, even if you wear a mask, because you got COVID. Mask only protect you like 40%. And keep distance away from other people, at least 6 feet, so you don't get COVID. Yeah, don't die from it. There are 2,000 Americans dying every day. Don't be among the 2,000. But have fun. Go to the beach. There's Ocean City. There is Virginia Beach. Wake up early, like 4 a.m. if you want to go to Virginia Beach. I mean, you can't really stay out late at night and have fun, right? So you go early, come back early, But yeah, have fun. I mean, don't miss out on the fun, because your children are the ones you love. You want to spend time with them, you know. When you're alive, because you may die before Christmas. Yeah, I hope you don't die. That's why I created the show. But I'm just saying it's possible. Um, yeah, yeah. So thanks for watching my show. I try to provide you with content that you need. You need to understand what's going on, and I provide you content that you need to know from all different angles. Right? That's why this show is so valuable. That's why you should watch this show every day. Tell everybody you know to watch this show every day, because you're not going to get this from anywhere else. And I don't believe in liberal media, and I'm sure you don't believe in liberal media, because they're not going to give you the facts. I'm going to give you the facts. So make sure you watch COVID-19 Update by Heerak show every day. And I'll look forward to seeing you tomorrow. I hope that you will be well. And that your family will be well too. And I will bid you adieu for now. See you tomorrow. Bye.